our topic is compassion training in action. We're thrilled to have with us today Vickers Yellapu, MD, a newly graduated medical doctor, and Dr. Leah Weiss. She is a lecturer at Stanford University, founding faculty member of Compassion Institute in Palo Alto. And we're going to talk about compassion training. And there's been a lot of stuff talked about in the media about compassion training, mindfulness, physician burnout, suicides. Tell us about this compassion training. How is it day to day and in your work? What is it like?
So compassion training, the course that we developed at Stanford, begins with the foundation of mindfulness, and then it moves on to relate compassion in our day-to-day lives in increasingly widening circles. So it's an interesting, one of the core ideas behind it is turning on its head, in a sense, the education many of us had around Darwin and survival of the fittest, and it's all about competition. And yes, that is a part of how we've evolved and who we are as individuals and communities. And at the same time, there's another side to the story, which is within our tribe, the need to support each other for our collective survival, the selection towards compassion and care. If you think about protecting offspring, if you think about caring for elders, and so the interesting thing is to think about if both of these sides are part of who we are as individuals and collectives, what can we do to make sure that the compassion becomes more pronounced rather than destruction of in competition in its most negative sense. So this course really starts people where they are, paying attention in their day-to-day lives, their experience of human connection. And the Mindfulness Foundation comes from the place that if we don't notice suffering in the people around us, there's no opportunity to be more compassionate towards them. And so in increasingly widening circles, we develop compassion over time through the use of didactic conversations, exploration, in terms of critical thinking, but also meditation is an important piece of this training. I'll stop there for the moment.
So you mentioned a little bit about physician suicide, 400 a year, and that there's a great deal of physician burnout. We understand that physicians have been under enormous stress the last decade with decreasing reimbursement, changing of the structure of medical care, and trying to meet the needs of increasing numbers of patients, who are just older, coming to the forefront with more illnesses just because we're living longer. So tell us a little bit about how you would intervene with that.
So for physicians and for healthcare providers, one of the things that we're trying to look at is to support in resilience. It's an extremely demanding profession. I don't need to tell two doctors that. I grew up in a family of physicians. My father was a surgeon, my sister is a surgeon. And I think one of the things I've seen from the family perspective is the impact of having a profession that you never clock out. If a patient needs you, if there's something that has to, if there's an emergency, if there's follow-up, it's a core part of identity. So then the question becomes, how can we buffer, how can we help doctors have sustained medical practices and also lives? So we know things like sleep and self-care are important, but it's easy to say you need to sleep more when the reality is that physicians, and when they're in their training, even if you limit the number of hours that residents are working, someone else has to pick that slack up. So there's no real simple solutions, and at the same time they have a real cost. So in terms of the compassion training itself, when we work with physicians, one of the things and providers that we look at is trying to get to the core of how can you do compassion without empathy fatigue, without getting so either overburdened by your patient's suffering or detaching yourself at the other extreme. Neither of those are going to be good for you. If you try to turn into a robot during the day, it's hard to become human again when you walk in the door at night. So there has to be a way that's sustainable throughout the workday into the rest of the roles that people are filling. And that's something that compassion training and learning, and in some cases relearning, either ways to relate more if physicians have been trained to have such an extremely detached perspective. That's not helpful for them. But they also, I don't want my doctor crying with me when I go into an appointment. So there's a balance there that needs to be found. And well, maybe this is a place you can weigh in as well, what you saw in your training and in your experience to prepare you for this demand.
No, I really agree with what you have said. I think there needs to be that balance, but again, I'm in training, so I'm not sure. I haven't really come to that point where I have had to meet that balance, but I wish they would teach us more of that, and because as we go on through our medical training, we do tend to become more disassociated with the actual life perspective of the patient, whereas we're more focused on like the academic perspective. So reaching that balance is difficult, and we would be open to any tips, and we'd be willing to learn to find that balance.
So let's say we have a 58-year-old general surgeon, and his field has been changed because it's no longer the big bowel surgery, but it's really laparoscopic, Da Vinci robots. And so he's got challenges on one end, and he feels that he has this increasing burden of patients who are very ill. So he may feel burnout. And how can he refresh himself? What is it? Besides, we should take the course at Compassion Institute. But tell us, what would you think? What do you do, diagnose or suggest? How do you do this?
Well, one of the things that's useful is to recognize the signs of burnout so that we can see them in ourselves, in our colleagues, and our family members. So as you mentioned, this sense of, it can be detachment. It can be this, when we start out in our professions and we so badly want to help, and then the kind of veering towards a cynicism, caring less, maybe substance abuse or use is rising. Those can be warning signals. Trouble sleeping, or finding yourself not investing time in self-care. These are all signals that burnout could be happening. And if that's the case, one of the really important parts of the compassion training is actually self-compassion and relearning how to relate to our internal way of talking to ourselves. And many of us, especially highly educated or not actually, we're so self-critical. And what I see with a lot of the graduate students I work with at Stanford, and whether that's in medicine or MBA students, that there's this belief that the reason I've done so well in my career is because I hold myself to a higher level of accountability. I get to that higher level of accountability because I beat myself up harder. So it's fine for you to be compassionate and sort of take it easy on yourself, but if I want to be awesome, then I need to basically self-flagellate. And so I think this is a core belief that in the class has to get looked at. Is that true? Well, there's a lot of research suggesting that self-criticism actually is not helpful in terms of learning or engaging with the work that we're trying to do well. That actually leads to procrastination. It leads to avoidance if we're being self-critical. Fear. And it gets the whole cycle of, it activates our threat system. The threat is coming from inside us, but it's still a threat. So some of this, I think.
So maybe we achieve, but we pay a price.
We pay a huge price, and it actually may be undercutting rather than supporting our achievement.
Right.
But the only way to really, I can say that and I can point you to studies, but the thing that happens in the compassion training that I think is powerful is for people to really look at go forward tomorrow, today, this week, and look at what is the role of self-criticism. Is that really helping me to do better, or is that leading me towards behaviors that are harmful to myself and others?
So it's sort of like the self-criticism will help you briefly, like the short term, but not the long term. For all we know, you could be winning the Nobel Prize, but you're beating yourself, so you can't really achieve what you really can be.
And it builds this negative perfectionism. So we want to be impeccable. We want to do well. We want to perform and contribute. But the negative perfectionism that's fueled by the self-criticism is actually we hold ourselves to standards that are so high we can't meet them, and we don't have this growth mindset where we keep trying and we can take difficulties and negative feedback and learn from them. It actually makes us hide out from the challenges.
Right, and then you have release of epinephrine, the hormone, makes your blood vessels bad, then you get hypertension. So you can only beat yourself so long. It's like you can't beat a dead horse to death. So I love this concept. It's really building on what all the sports psychologists also talk about, that to be in the zone, you have to visualize your best golf stroke, your best tennis swing, your best whatever. And then you let go, and you go into that zone. And so it's the same way.
That's right, that's right. If you think of it as overly trying and pushing on this side, and like sitting on the couch eating bonbons on that side, that if you want to get into a kind of flow state, or the zone, whatever language you want to use, it's somewhere in the middle. It's a relaxed engagement, which is part of why we need to practice and practice and practice at whatever our professional skill is, so that when the time comes, we can do it in a more relaxed way. Because, you know, like when we learn to drive and we're all, you know, our body's stressed and we're worrying, are we going to crash, are we going to crash? You know, eventually when you've practiced enough, you can probably be a lot safer without that extra level of agitation.
We mentioned off air before we got into the show that the telomeres are lengthened in the biological system and that we increase life expectancy. Can you go over that again?
I'd be happy to. So some of the really interesting research that's happening with contemplative practice, compassion meditation, mindfulness meditation, is looking at the biological impacts of what happens in our bodies when we do these practices. And the telomere piece is that, so telomeres, a reminder, is the long strands of DNA, like a shoelace, at the end has this cap, like the little plastic piece that keeps our shoelace from unraveling. Those are the telomeres. And as we get older and older, they shrink. Also, when we live with trauma or stress, so this has been something that the Department of Defense has done a lot of research on for the impact of trauma and stress and the telomere shrinking. So one of the things that we're finding is that when people increase in compassion and mindfulness, the telomeres lengthen. Literally at the cellular level, if you think the metaphor of stress and it making us contract, that this analog happens literally at the cellular level, that there's an expansion that happens. I mean, that's a metaphor there, not a direct, but actually the genes are impacted. Another really interesting and related set of studies, Steve Cole, who has a genomics lab at UCLA, he has done a lot of work in this space, looking at the impact on our gene expression when we do these kinds of practices, specifically ones that go against social isolation. So compassion, social connection, higher sense of purpose, all of these things give our genes a more positive, healthful expression that relates to the sequence he's interested in, relates to inflammation and antivirals and the cellular level. So we're literally, you know, from multiple angles of research, we're looking at how do these practices translate down to the smallest increment.
Well, you know, in cardiology, stress is a big actor. And now, you know, in the 21st century, we're finding out that more and more it's related to hypertension, to cardiovascular disease, such as a heart attack and other things. And they find that stress can affect your immune system. Then you get into the autoimmune problems like that are still largely unsolved, and we only have recently new treatments. So this stress, so reducing stress with compassion training, with meditation, and being aware, like knowing the whole community that you're with, your family, your bigger community, your neighbors. Tell us how that impacts, let's say, your class in Burnout. Tell us.
Mm-hmm. Well, one of the things that's really interesting, and again, there's a lot of research at Stanford in the psychology department looking at emotion regulation and how we handle our emotions, how we handle stress, and how that shows up not just in the mind, but in the body. So when we suppress, then basically it's causing all this extra stress on our system. So if we have feelings we don't want to experience and we try to stuff them down, or like, you know, if you picture a balloon and you try to poke it in, it creates issues in our body as well as our mind, and it actually ultimately fails because we can suppress, but then at the worst possible time, for maybe seemingly no reason, the emotions that we weren't responding to pop up. And so one of the things that I see when we're training people in the compassion training courses is we're teaching them, how do you deal with emotions and stress in a way that you don't have to either suppress them, or the alternative people jump to is like act them out. Like all of a sudden I'm going to have to start throwing stuff because I'm angry. You can be angry, you can be sad without either stuffing them or demonstrating them in inappropriate ways. And that is the skill set that takes practice. That's a lot of what we look at, is how, and not just we do it in ourselves, but also how do I deal with you when you're angry or you're sad? That's the stuff of compassion, to find a way to have the comfort and the solidity that I can be there and respond to your suffering. So again, back to the healthcare providers, day in, day out, there's a reason they call this vicarious trauma. They're around suffering, and if they're meeting that all the time by being upregulated themselves, that's going to have a really negative impact, not just on them, but then on the patient experience of them. So it becomes this whole question of relearning how to relate to emotions in myself and in other people around me is fundamental to burnout.
And also to recognize what are your triggers for this.
Absolutely.
And to recognize that you have issues in dealing with those triggers, and how to change your own environment. Let's say if you're a physician, how to change that, maybe take less call, hire an associate, and find a joy that we should find in medicine. Oh, this is really very interesting. Now, about teen suicides, and you know, there's like a mini epidemic in Palo Alto where people throw themselves in the train tracks and they're 14, 15 years old. Do teens have insight for this? Are they capable yet of having insight for this type of training?
That's a great question. What I see, I have my oldest just finished kindergarten in a Palo Alto public school. And from her very first experience of kindergarten was learning the vocabulary to understand her emotions and to communicate to other people what she is feeling, and to ask them what they're feeling. And they use metaphors like, you're dipping my bucket. So this idea of having a bucket of emotions. And so it's a very sort of, you can picture what it looks like to have, you know, feeling good, your bucket is filled, somebody else comes and knocks your bucket over, you feel terrible, and it's a way to express it. So my point is, you can developmentally at any age be working with these principles. And you know, it's interesting, it's the same skill set that graduate students are working with. Recognizing emotions, emotion narration or recognition. So I know what I'm feeling at any given point. That is the foundation for being able to manage my emotions. So I do think it's possible for adolescents, but you know, the methods might look different than for either adults or my kindergartner.
Do they say, actually in kindergarten, you're dipping my bucket?
I get told that.
Oh, so basically they're training them to be much more holistic, to be able to communicate. That's really great. You know, I think back in the days when I had younger children, they taught us to go read Piaget and Bruno Bettelheim, you know, which is abnormal child psychology. You know, getting in touch with yourself sounds kind of simple and new age. However, I like what you say, that it's more analytical, in the sense that you have to know yourself, your environment, your triggers, your work environment, your community, your family, and they're always triggers because nothing works the way it wants all the time. So what is like a mini course? If you were to tell us in, you know, 50 words or less to the home audience, and you're, okay, and we don't have our mobile app to search the web to do it, what would you say? Okay, well, am I burnt out? What are like the things that you look for?
So how am I paying attention to how we're thinking about our day-to-day activities, how we're showing up? Are we veering towards being cynical or disengaged? And are we just even recognizing that we have the power to change how we're relating to our emotions and how we're relating to our experience can actually go a very long way. I asked Jimpa, when I first, Thupten Jimpa, who is the main author of the compassion training protocol, when I first started working with him right out of my graduate work, I was asking, what is the main sort of thought change that you want? Of the many things people could learn out of the mindfulness portion of our program, what is the most important? And his answer was that if they can understand that thoughts are just thoughts, that stories are just stories, so that we're narrating, we're constructing our experience, and that we can change that and do it differently, that would be a key takeaway. And what would we do differently? It's about the social connection. It's the fundamental thing that we can change. How are we relating to other people? How are we, what's blocking us? Getting more clear, what are the patterns of the patients or the frustrations in the system with the paperwork and the insurance payment, or whatever our profession is, the people in our lives, getting clear on the patterns that frustrate us and starting with those. That's the place to work first. That's what the compassion training does, becoming aware and then experimenting with trying something different.
So when you say thoughts are just thoughts, so that we're able to just say, oh, I have this evil thought against the drug company that won't give my patient free medication, to be able to dismiss it and let it go. It's just a thought. And then go to the next better thought.
Right. And you might decide, this is an important thought and I'm going to pursue this in terms of action. But the ability to kind of step back and have a little perspective on what we're thinking. So if what we're feeling on our drive into work is, I don't really want to go here, I don't want to be here, I'm exhausted, don't care. We don't have to beat up on ourselves that that's what we're feeling. It's recognizing that burnout is a dynamic that happens between the person and environment. So we don't have to blame ourselves.
So I think that it's important, it seems, from talking to you, that we should be authentic, feel ourselves, allow ourselves to have the feelings, but not beat up on ourselves. So if we have a nasty thought about this driver who cuts us off in the lane, acknowledge that you're angry, but then go on, because you can.
Right.
That you're in control, that you can. And so this is very empowering, that you can have all these feelings, but try to go beyond that. Now, in our last few minutes with the take-home message for the audience, what would you like to tell the audience, home audience, and the 3 things to remember for compassion training, to let them know, like they're stuck in a desert island, and they need this?
So even if you don't change your environment, you can change your experience of the environment. That's the first thing to realize. You can change how you experience your day-to-day. You can emotions are not a problem. They're important information, and you can learn to deal with them in a way that is going to make you healthier and happier. And then the third, I would say, is you can train, that you should, and you could, and maybe should, find some system, if not compassion training, but some way to develop a practice and an ongoing exploration for becoming a more compassionate person in your day-to-day life. That you can do this. Tens of thousands of people have done this before you, and they didn't start off from a more advanced place. They just took the plunge, and I think that's something that you could do too.
Take the plunge. Don't beat yourself up. Be authentic, because being authentic makes you feel better, feel yourself better. And really try it out. Don't be afraid. And that you yourself can change it, that you can change it. And then come to the Compassion Institute in Palo Alto. It's 650-683-0820, Compassion Institute, Palo Alto. Casey Branscombe is executive director. Leah Weiss, Dr. Weiss, is a founding faculty member. She specializes in physician burnout. And as a physician, I can speak for myself. I think the only reason I haven't been burnt out is I get to do fun things like this TV show, and I try to engage my patients in my free diabetes apps, that I try to make apps for them that they can interact with me and learn from it, and to constantly feel that I am helping them, every day in a positive way. So anyway, if you like this show, donate to KSAR Television, Saratoga. I know that's being beamed into Los Gatos. And come join us, send us messages. Mr. David Lee is station master, and we're very grateful. Thank you very much.